There is no excuse for inaction. My message is very clear. Act fast, act now, act decisively. A laissez-faire attitude to the virus, not using the full range of tools available, leads to death, suffering, and hurts livelihoods and economies. It's not a choice between lives or livelihoods. The quickest way to open up economies is to defeat the virus.
In 6 UN official languages, plus Portuguese and Hindi.
This is not the time for complacency. While we continue to receive encouraging news about COVID-19 vaccines and remain cautiously optimistic about the potential for new tools to start to arrive in the coming months, right now, we're extremely concerned by the surge in cases we're seeing in some countries, particularly in Europe and the Americas. Health workers and health systems are being pushed to the breaking point.
In Geneva, and welcoming you to our global COVID-19 press conference today.
This is a dangerous virus which can attack every system in the body. Those countries that are letting the virus run unchecked are playing with fire. First, there will be further needless deaths and suffering. Second, as we featured 2 weeks ago in a press conference, we're seeing a significant number of people experiencing long-term effects of the virus. Third, health workers in particular are facing extreme mental health pressure, and cases are severely burdening health systems in too many countries.
In November, present in the room is the WHO Director General.
G20 leaders will meet this weekend. This is an opportunity for them to commit financially and politically to the ACT Accelerator and COVAX so that together we can end this pandemic quickly. It's also a moment for us to strive for the world we want. This cannot be business as usual. The time has come for a fundamental shift toward health being seen as an investment rather than a cost, and the foundation of productive, resilient, and stable economies.
In the room, also Dr. Mike Ryan, Executive Director.
Delivery characteristics of vaccines are also important, and we will be looking really carefully at the ease with which different vaccines can be delivered, and certainly about the number of doses that are required. This is a 2-dose vaccine, and certainly any vaccine that can achieve a 1-dose vaccine is certainly easier to deliver than a 2-dose vaccine. And of course, the cold chain characteristics are also important. So information from the Moderna vaccine about its requirements of both -20 and then refrigeration for a period of what they're indicating, maybe a month period, is welcome news as well.
Dr. Ed Kelly, Director, Integrated Health Services.
The question, I think, was about the news of the Moderna vaccine.
Yes, exactly.
That is quite encouraging. We've just heard about the interim results from the press release from Moderna. It's a fairly detailed press release. And we know that in the interim analyses, it appears that the vaccine has a protective efficacy of over 90%. It's about 94%.
Dr. Mariangela Simao, Assistant Director General, Access to Medicine. And
I think we're looking at least the first half of next year as being a period of very, very limited doses. Supplies are going to be limited. There are bilateral deals that many of the companies have done. So many of the doses have already been booked by some countries. We are hoping that there will be enough in the facilities so that the AMC countries, the 92 countries in the AMC group, will also get access to these doses at the same time.
And Mr. Steve Solomon, Principal Legal Officer at WHO.
There have been 65 cases associated with HQ staff, headquarters staff, not all of which have been on the premises. There have been 36. Those 65 are from the start of the pandemic. So let us be very clear on that. And clearly, the AP is reporting on an email that was sent to staff about that. So those are 65 cases reported since the beginning of the year. 36 have had access to the premises, who have been on the premises. I'm back in because I'm being asked to clarify. So when I said that there were 36 cases associated with the premises, that's since the beginning of the pandemic. There have been 5 cases testing positive in the last week.
And Mr. Steve Solomon, Principal Legal Officer at WHO.
But I was okay, no symptoms. It's day 17 now, and followed the protocols because of no symptoms and also the full follow-up of the protocol. I didn't see the need for testing. I can assure you that I'm okay.
I will hand over to Dr. Tedros for his opening remark. Dr. Tedros, you have